other one in Hollandale Beach. Hollandale Beach, we're off of 17th Ave, East Hollandale Beach Boulevard. And then we have a bunch of other offices throughout South Broward. We also have 2 urgent care centers. One of them is on the corner of Hollywood and Dania Beach. That's US 1 and Sheridan. If I can be of any assistance, answer any questions, please feel free to reach out. Thank you. Thanks for having us.
Thank you, Jocelyn. Nirupa?
Hi, everyone. We're really glad to have you guys here today, and we're excited to hear Dr. Goldman for some very important information. My name is Nirupa, and I'm with Memorial Community Relations.
Thank you, Nirupa. And I see Pat unmuted herself. Say hi to everybody.
Hi, everybody. I've never done this before on my phone, so I had to change a bunch of settings. For some reason, it won't come up on my computer. So I am the president of the chamber, and Randy and I work together really well, if I do say so myself. I have a promotional products company that I work for called Savvy Solutions. We provide solutions, savvy solutions, for your marketing challenges. I'm also the president of the Hollywood, Florida Scholarship Foundation. We provide money for seniors in high school who live in Hollywood and Dania Beach. That's it for me. So glad to be here. Thank you, Randy. You always do such a great job.
Thank you. And thank you again, Norma, for helping us flow through this. So without further ado, Dr. Jennifer Goldman, DO, is a board certified family physician and the chief of Memorial Primary Care. Memorial Healthcare System has multiple primary care practices across South Broward County, all of which are NCQA Level 3 certified patient-centered medical homes, which you will explain what that means to us. MHS is one of the largest public healthcare systems in the country and a national leader in quality care and patient satisfaction. Dr. Goldman is fluent in 3 languages, English, Spanish, and Creole, and earned her medical degree from the Philadelphia College of Osteopathic Medicine in 2004. Her internship and residency in family medicine were completed in South Florida in 2007 in affiliation with Nova Southeastern University. Dr. Goldman, thank you so much for participating today.
Oh, thank you so much for inviting me. I always love the beginning part of these chamber meetings. It's so fun for me to hear from everyone and all of the businesses involved in our community. Really, it makes it special. So I'm actually glad I joined earlier than I did. Can everyone hear me okay?
Yes.
Yes. We can.
Now she muted it. I can't hear nothing.
Oh, it's muted now? Okay.
Now you're okay.
All right, very good. I was just going to ask if one of the organizers could allow me to share my screen. Right now, it seems like it's disabled. And in the meantime, I'll tell you all about patient-centered medical homes because that's close to my heart. So patient-centered medical home is really where we put our patients, our community members, at the center of everything that we do. We are a community program. And so we surround our patients with what they need to continue on their journey toward wellness and health overall. And so we don't put the physician at the center of our practices, we put the patient at the center of our practices. And that means that we have health coaches and nurses, social worker, even a legal aid attorney at one of our practices to help people with things like evictions that can impact health. And we also have pharmacists within our team, as well as many others. So patient-centered medical home is exactly what it sounds like. We put our patients and our community at the center of everything we do.
Dr. Goldman, you should be allowed to share your screen now.
Wonderful, thank you. So this is what I'm gonna do. I'm just gonna actually move this. I know, here we go, let's see. Okay, so you all should be able to see the slideshow now. Let me see if I can make it bigger. Can you all see that okay?
Yep, that's perfect.
Okay,
Thanks.
fantastic. So this presentation really is not intended for me to do all the talking. I will speak for maybe about 15 to 20 minutes. Many of you have probably heard a lot of this information before, but I hope to distill it in a way that that makes you look at things maybe a little bit differently. And then the rest of the time, I'd love to hear from you. So I'm hoping for a lot of participation. I'm really open to questions, and this is why I love to do talks, because I love to hear from everyone in the community. So really, this is about the COVID-19 vaccine, as well as sort of the state of COVID in the world right now. And the title is I Did It, Why You Should Too. And that's really a plug for the COVID-19 vaccine, which is so important to staying alive through this pandemic, frankly, and not getting very ill from the new Delta variant. So the agenda, really a brief introduction, and then 3 things that I want you to remember. 1, the state of COVID around the world. 2, the Delta variant and why we care about it. And 3, that vaccines save lives. So introduction, I've been a family doctor for almost 15 years now. I'm the chief of Memorial Primary Care. I was the medical director previously for the COVID-19 vaccine pod at Memorial Regional, as well as of the CB Smith Park COVID-19 testing site, where I spent most of 2020, in addition to being at Memorial Primary Care. So and every time I do these presentations, I always look back at the statistics, because unfortunately, as everyone knows, the pandemic continues to be a problem, and cases continue to climb. And so around the world now, we're getting close to 200 million cases. It's staggering to think about, and over 4.16 million deaths. In the US alone, over 34.6 million cases and over 611,000 deaths in the US. Cases have really more than quadrupled over the last few weeks, over the last month. Hospital admissions are going up. People are still sick and needing to go into the intensive care unit. And so hospitals around the area are once again having quite a few patients who have COVID in the hospitals, and the vast majority, between 97 and 99% of people who are admitted to the hospital now with COVID are people who do not yet have the COVID vaccine, or who have not been fully vaccinated, meaning they haven't completed the series of their vaccine. Also, you know, the untold story that I like to bring up often is about what happens if you have COVID and maybe you have a mild case, but you're just not the same afterwards. So you can't get back to living. And this is what has been termed long COVID. And there are additional hundreds of thousands of people who are suffering with fatigue, brain fog, some difficulty breathing still, painful joints, depression, anxiety. There was a recent study that showed that a full 30% of patients who had COVID suffer from post-traumatic stress disorder as a result of their experience with this disease. And so it is terrible on all levels, whether somebody is admitted to the hospital, to the ICU, or if they're living with this or living through this at their home, it's still very traumatic. So with regard to the COVID-19 vaccine, there are 2 mRNA vaccines that have been authorized for emergency use by the FDA. That's the Pfizer or BioNTech mRNA vaccine and the Moderna vaccine. Both require 2 doses. And please remember that if you have the first dose, and we'll talk about this a little bit as we get to the Delta variant, but you're not protected after the first dose. The most recent study in the New England Journal of Medicine showed that after the first dose of Pfizer against the Delta variant, you're only about 30% protected. Now, if you're fully vaccinated after 2 doses, then you're close to 90% protected. And so really, really important. We've seen a lot of people in our offices now who are coming in now to get the vaccine, which is wonderful, but then are exposed to COVID right afterwards and end up, you know, having a case of COVID despite having had the first vaccine. So please remember that you're not protected until 2 weeks after the second vaccine. dose. And then there is still the Johnson & Johnson vaccine, which uses an adenovirus vector, so a slightly different mechanism of action than the mRNA, but still it does, get to basically the DNA of the cells, which causes your body to make antibodies to fight COVID-19. And all of these antibodies that you're making are attacking the spike protein, which is this, red spike on the outside of this COVID vaccine ball that you see in the picture here. Every single one of the vaccines, Pfizer, Moderna, and Johnson & Johnson, prevents severe illness or death from COVID-19. That is really why we get vaccinated. So that's the entire purpose of this. For kids, Pfizer is now approved for vaccinating children ages 12 and up, and the dosage is the same for adults. And the most common side effects are the sore arm, fever, chills, some flu-like symptoms, which last about 24 to 48 hours. That's very similar in kids and adults. And we often see it only after the second dose. So many times after the first dose, we really don't see any symptoms at all. Of course, some people do have, but most of the time it's after the second dose only. And why should we vaccinate our children? I think many people have heard, COVID is really not a pediatric disease. Many of our kids don't get sick when they get COVID. So why should we inoculate them, right? Why should we give them a vaccine to prevent it? And the reality is that there are many, many children who are getting sick from COVID. There have been over 4 million cases in kids 11 to 17. Many of them do have mild infection, but some go on to develop multi-system inflammatory syndrome, or MIS-C, and this can be life-threatening. And also kids are vectors. They spread COVID to vulnerable adults, and that's been proven time and again. And so we vaccinate our kids to protect our community as well as our children. The Delta variant. So if you look at this, the right side of the screen where the graph is, the dark orange color in here, this is representing the Delta variant. So this is from April of 2021 through mid-July of 2021. And you can see that the Delta variant now represents over 83% of COVID cases in the United States. So it is far and away the dominant variant. And why do we care about it? I mean, in reality, we treat it exactly the same for the most part as the Alpha variant or as the Gamma variant, as other variants that have been in existence. But the problem with the Delta variant is that and viruses are smart, and that's sort of the thing. Viruses are, their entire method or reason for existing is to survive. And so they try to evade our immune system. They try to get around the immune system so that they can spread faster. And this Delta variant figured it out. And that's why it makes it so dangerous, because this is far and away more contagious, more than 50% more contagious than the Alpha variant, which is the prior variant that we were dealing with. And this means that only a very short time in a room with somebody, in a closed room with somebody without masks, and we're talking just a couple of minutes at this point, can increase somebody's risk of getting COVID. They can spread COVID just after a couple minutes of exposure. We also do see that fully vaccinated people can become infected and they can spread the Delta variant as well. But the illness for the fully vaccinated person is really mild. And so many times a fully vaccinated person, if they are exposed to COVID, if they do test positive for COVID, they'll have mild symptoms like kind of like a cough or some congestion, or in some people it's just loss of taste or smell, and that's all that they have, and then they're fine. Of course, there are some others whose immune systems may not be working as well as they need to, and maybe they didn't mount an antibody response when they got the vaccine, and they can of course become more sick. And so this is again a reason why the more people get vaccinated against COVID, the less chance the virus has in changing. The less variants that will pop up, the less chance that the virus has to evade our immune systems, and the more chance that we have to really beat this thing. And again, as I mentioned before, over 97% of people admitted to the hospitals are unvaccinated. And then this is the article that I was referencing from the New England Journal just from the other day, July 21st. They looked at the Pfizer vaccine, the BioNTech vaccine, and it's still 88% effective at preventing the Delta variant after 2 doses. And so if there was anyone in the audience or anybody in the community that was concerned that, you know, these vaccines don't work anymore against the Delta variant, that just could not be further from the truth. These vaccines work extremely, extremely well. There was sort of a funny analogy explained the other day that I heard that I thought was great. And that is that, you know, seatbelts don't always prevent you from getting into a severe car accident, right? You can wear a seatbelt and you could still get into a severe car accident, but we wouldn't really, most of us wouldn't think twice about putting on our seatbelt because we know it prevents us from dying in many cases from a car accident. It's the same thing as the vaccine. It's not going to prevent 100% of cases of COVID. People will sometimes get COVID if they're exposed to it, and we'll talk about what you can do to avoid exposure. But if you do get the virus, if you do become positive for COVID, the chances of you being admitted to the hospital, getting admitted to the ICU, being intubated on a ventilator, or dying from COVID are just so minimal after the vaccine that that's why we get the vaccine. Okay, so I hope that everybody understands that point. This is the updated CDC recommendations. There was some controversy over the CDC's recommendations a few months ago where fully vaccinated people could go without a mask anywhere they wanted to. Now, because of the Delta variant and because of new information that fully vaccinated people can get really mild cases of COVID without symptoms many times, but they could still spread the Delta variant because of how contagious the Delta variant is, then the CDC just released recommendations yesterday that, you know, that everybody should wear a mask, whether they are vaccinated or not. So fully vaccinated people in areas of high transmission, which is all of the orange and red areas. And of course, in Florida, we are the epicenter of this. We have some of the highest rate of new infections in the country right now. So fully vaccinated people really do need to wear that mask indoors, even when they are among other fully vaccinated people. And I know that that's a change, but again, I look at it this way, just like our patient-centered medical home concept, where we put the patient, we put the community at the center. I think that as a community, we have to put our vulnerable at the center. We really do. We have to take care of people whose immune systems are not functioning like ours are, who have chronic conditions, and this virus would really cause major problems. And we have to push everybody that we know to get vaccinated. And we also have to wear our masks because it is basically a sign of respect for others that are in the room whose immune systems may not be as highly functioning. There's also an update from the CDC that universal indoor masks should be mandated for all teachers, staff, students, and visitors to schools, regardless of vaccination status. And so this is the newest information, and I do wholeheartedly endorse it. I think that many of us have just gotten used to the mask and need to get used to the mask in the times to come until we can get to over 70% of our nation vaccinated against COVID. And frankly, we're just not there yet. So this is really the final slide in terms of why you should get vaccinated. It's really to not die from COVID. That's why you get vaccinated, so that you don't die. And it's also so that you don't get very, very sick from COVID either. It can be a miserable experience, and we want to prevent everybody from going through that. And then Dr. Rochelle Walensky, who's the CDC director, did make a comment the other day that this is becoming a pandemic of the unvaccinated. And her point there is that the people who we see in the hospitals, again, 97 to 99% of the people that we see in Memorial Healthcare System now with COVID who have to be admitted to the hospital, they have not been vaccinated yet. And so please, if you haven't been vaccinated yet, or if family members or friends of yours haven't been vaccinated yet, please, please emphasize how important it is to get vaccinated. Please get vaccinated, guys, so that we can move beyond this pandemic, so all of your amazing businesses can thrive in this coming year, because that's really all we want. And that's it with regard to, these are all of our practices that Jocelyn was talking about, and we are expanding. So we'll have quite a few more practices actually in the coming year. And I will stop sharing so that you all can see my face if needed, and I'll take any questions that you have.
Thank you, Dr. Goldman. Questions?
You want us to ask, or do you want us to put our hands up?
I think
Can
we're a
ask.
small enough group that you can just ask. I mean,
So one question, after you get vaccinated, should you go back like 6 months after the vaccination and see how the antibodies are doing in your system so you're aware of it?
what a great
Good idea.
question.
Because I'm that's one question. And the other question is that I don't know why people are so hesitant of getting vaccinated, because technology has changed so much, medicine's changed all the time. And I don't understand why people, even their own kids, because you have to have other vaccinations to put your kids in school. So what is one more vaccination? I don't understand. And maybe as a doctor, is it all political, or is it just the times? I don't know. That's my question.
Thank you. Okay, so antibodies and vaccine hesitancy, just so that I can keep it straight in my mind.
Right.
So with regard to after the vaccine, once you're fully vaccinated, should you get antibody testing at all? And actually the official recommendation backed by the CDC and healthcare providers is that you shouldn't get your antibodies checked. And that's because a couple of things. Number one, you may very well show antibodies on that test, and that's great. But we still don't fully know how long they last. And since, again, the CDC is recommending that we wear masks anyway, I don't want to give somebody a false sense of security if they do get an antibody test and it shows that they have antibodies, that they can sort of do, whatever they want, wherever they want. I think that there's still a chance that they could get sick, even if it's mild, and there's a bigger chance that they could spread the virus to somebody else if they do so. And so I really don't recommend antibody testing. The second thing is, if you don't have antibodies, that doesn't mean you're not protected. And so there have been people who tested their antibodies after the vaccine and thought, oh my gosh, I never mounted an antibodies response, I have to go get another vaccine. And that's just not recommended. And the reason is because when we get the vaccine, we're teaching our bodies how to make antibodies against the spike protein, whereas the commercially available antibody test is not just about the spike protein, it's about COVID, the virus particle in general. And so some people have mounted a very high response to the spike protein, but it's just not showing in the commercially available antibody tests. And so we really officially do not recommend that people get antibody tests either right after or 6 months after the vaccine. I do recommend that people continue to be very safe and careful and wear their mask.
Okay.
So that's the first part of that question. The second part is hesitancy. And I think hesitancy is complicated. We see patients from across the community. You all know that in Memorial Primary Care, we are payer agnostic. So we see patients with insurance and without insurance all through the same door, in the same waiting rooms and everything. And it's really ideal for how we practice medicine. And so as a result, we also see people from across the political spectrum, and we absolutely have not seen this as a political hesitancy. I wouldn't characterize this as only a political sort of issue. The way I look at it is that people have, real legitimate concerns, but also need corresponding real legitimate education. And what happens is that there's been a list of sort of reasons for hesitancy. So the most, the sort of top few on that list are the vaccine came out too quickly. We don't know what the side effects are going to be long term. I don't think I'm at risk for getting real severe COVID, so why should I get vaccinated to protect someone else? I'm worried about fertility and other issues. So those are the main ones that we hear. And then the last one is just, I just don't trust the information that I've been hearing about vaccines, so why should I put that in my body? And so what I always say is, listen, I validate all of those concerns. Absolutely. I understand that you're concerned about long-term side
Mhm.
effects of a vaccine, and we just don't have that information yet. But at the same time, when the polio vaccine came out, people, we can thank science for the fact that we don't all have polio today, and we didn't know what the long-term impact of the polio vaccine would be, but we knew that we were in the middle of a pandemic. It was a pandemic of polio at that time, and that we needed to stop it, and we needed to keep ourselves safe and our neighbors safe. And it's really the same thing here. And on the same token, vaccines have never been proven time and again to cause long-term effects. It's just scientifically not the way they work. When we teach our bodies how to make antibodies against something else, it's not impacting our cells. This is not entering into our DNA. mRNA is a messenger only. It's not impacting our own cellular DNA, and it's simply giving our bodies a really sophisticated message to say, hey, be on the lookout for this guy because he's going to come and try to attack you, and you want to be ready. And so essentially what I do in my practice, and what all of our providers do, our physicians, our ARNPs, our PAs in practice, and our entire care team of health coaches and nurses, we really focus on the scientific facts and the truth.
Good.
Because there's a lot of misinformation out there, and depending on where you look and where you want to look, you'll hear exactly what you want to hear. So if you want to believe that the vaccine is going to cause infertility problems, you can find that anywhere on the internet right now. The fact that it's not true and that it has never been backed by science is not stopping people from posting it. And so I think that for me, that's really the biggest issue.
Thank you.
We have a bunch of raised hands, so I'm going to start calling them out. Cheryl?
Hi, I just had a question. I've taken the Pfizer, but I did notice that there was a statistic, let me just look at it here, that said that 88% of the Pfizer is still effective of preventing the Delta variant after 2 doses. So what about those who have taken Johnson or Moderna? How does that, what's the statistics on that?
Sure. That's a great question. So as far as we know, the Moderna and the Johnson & Johnson have both stacked up really well against the Delta variant. I can only quote the randomized controlled, fully reviewed studies in the medical journals. And so New England Journal just published the one on Pfizer on July 21st. And so I don't have data on Moderna or Johnson & Johnson. However, there is nothing at all to suggest that Moderna or Johnson & Johnson are less effective at preventing severe illness or death. And remember, that's ultimately the concern here. There's nothing that's going to make us bulletproof when it comes to COVID. There's no vaccine on earth that's going to prevent 100% of cases, though I know Pfizer has some really good data in kids, but there's just nothing that's going to prevent 100% of cases. And so again, look at it kind of as the seatbelt scenario, or funnily, as I heard the other day, as a birth control scenario, right? We all know women who've gotten pregnant when taking birth control, they still should take birth control, right? We should all still, if you want to prevent pregnancy, and that's a great way to do it. And you should still take it, even though it's 99% effective and not 100% effective. It's the same thing as the vaccine. And so it's a great question. I don't have the exact percentage for you for Moderna or Johnson & Johnson, but at this point, really the focus should be on getting whichever vaccine is available to you.
Thank you, doctor. Next up is Jesus.
Doctor, thank you very much for taking time out of your busy schedule to be here with us today once again. I would like to know more information about what's ringing in the news and in some countries about a 3rd dose.
About a 3rd dose. I wanted to make sure I heard the question. So you wanted to learn more about whether or not there's going to be a 3rd dose?
Yes, and why
Okay.
is there going to, and why there might be a 3rd dose?
Right. Very good question. And so, as you know, so let's take something that we all are really familiar with, like the flu shot, right? So with the flu shot, because the virus that causes the flu has so many different variants, and every year this virus, I mean, it's lasted forever, and viruses are really great at doing that. They just continue to morph. They change a little bit so that they sort of go around our immune system. So every year we need a booster shot against the flu, and every year scientists work diligently to look at trends and try to predict which of the variants this year of the flu are going to be the most deadly to us as humans. Let's make a vaccine against that. And so as our knowledge of COVID-19 is evolving, and as of course we know that there are new variants all the time, and we're looking to improve our response and our protection against these new variants, there is likely to be a booster shot. There's likely, now we don't have any yet, so I don't have any secret information about when that's going to be available. What I can tell you is it's likely, and that it's a very good idea to get a booster shot, because as COVID morphology evolves, as the variants continue to change and frankly get smarter and more evolved to evade our immune system, we're going to need more protection. So even though the vaccine is, the Pfizer, the newest data was that it's 88% effective against preventing the Delta variant, it's still potentially its response could wane, meaning you may need a booster of that vaccine or of another one to protect you against the variants to come. And so that's really the reason for the quote unquote third shot. And it may be more, we may need to look at this kind of like what we do for the flu and just say this may be an annual booster. The only other thing that I'll add for that is, again, a plug for getting vaccinated in the first place. And that is that the more people get vaccinated now, the less variants we're ever going to have to deal with, and the less booster shots we're going to have to deal with. So that really should be the most important part of this that everyone gets.
Thank you so much for the time, and thank you for your answer. I really appreciate it.
Thank you.
Pat? Pat, you had a question?
Unmute yourself, Pat. Unmute.
Unmute. Okay, I'm unmuted, right? So this is a personal question. First of all, I also want to thank you for your time and giving us all this excellent information. I have a surgery scheduled for Friday. It's a shoulder replacement. I'm thinking about not doing it because the hospitals are so filled right now with Delta variant COVID patients that I'm afraid to do it. On the other hand, if I don't do it, I might just take a hacksaw and do it myself, which would really be not a good idea. So what do you think?
That's tough, and I'm sorry to hear that. It's tough. Joint replacements in general are just necessary sometimes and just so difficult. But they are not considered emergency surgeries, right? This is something that I'm sure has been scheduled for quite some time. I have to say that the hospitals do absolutely everything we can to keep that environment safe. And so there's actually never been cases of transmission of COVID in the hospital to patients who are having surgery, within the ORs. It's kind of like in schools, actually, just a plug for masking in schools, kind of the same as what we do in the hospital. We protect ourselves head to toe. You know that we wear those N95 masks that kind of don't let anything in or out. We wear the face shields. We, cover with gowns and gloves and everything. And so when it comes to spreading COVID within the hospitals, that's just not happening. We're just not seeing that. And so hospitals are still a safe place to go when needed. However, when it comes to elective surgeries, I think that's a personal preference. There are certainly some surgeons who are doing some of those procedures at outpatient centers, at surgical centers instead of in the hospital. But of course, it would depend on your own personal risk factors as to whether or not you would be a candidate for that. So I know it's kind of a convoluted answer. It's a personal preference at this point, and it really depends on your pain level right now and whether or not you can go another day, because certainly none of us want you to cut off your arm on your own.
Thank you. I really appreciate it. I needed another opinion.
Okay, our last question is Scott Evans.
Thank you for that convoluted answer. And Pat, do not cut your arm off, okay? Please do not do that.
Okay.
This is a two-part question. It's very quick. It's very brief. I heard you just said 97% of the infected and hospitalized are from the unvaccinated. I heard 99.5%. Is that a national? Is yours local? And the other question, or actually statement, is, are you doing this as a general outreach? And is this something that you do as a presentation in general? Because I think someone like you going around to various groups, like I'm a member of the Lions Club with Jim Silvernail, and I think it would be very informative if somebody like you were to be going to different groups and organizations and making presentations to inform the public as a doctor from a reputable, hospital. So we know about misinformation, and it appears we're not able to combat that. As you could see, I'm a man of fighting misinformation by trying to get people involved. So without making the question any longer, is this something that you do outside of?
Sure. Well, so let me address just the 97 to 99%. I think that there are various figures when it comes to national or local, and it depends on, the number in the hospitals at that time. But what I use is the figure that the CDC reported, which is the 97%. I really think that their local hospitals, for example, have been seeing 99% of our cases inpatient are unvaccinated. But I think what you take from that is really that the vast majority of people who are getting sick and dying from this virus right now are the unvaccinated. That's why at this moment in time, this is a pandemic of the unvaccinated. And this is why we need to care about it. This is why we need to get everyone vaccinated. And this is why we need to spread accurate information. And the second part of your question, thank you first off for, I'm glad that you appreciated this presentation. I tweaked it before today, but Nirupa has me pretty busy and Jocelyn has me pretty busy with regard to presentations. So we're happy as a healthcare system to go around and present virtually on this topic. And I am so passionate about public health and about keeping our community at the center that I'd be happy to do so.
Okay, so do you have an email that you could share with, or Jocelyn, who is in charge of your scheduling, whoever can share that with us? I would be happy to be in touch because I think it's a great message to be relaying. And thank you, Randy, for putting this together because this is very important.
Thank you, Scott. Nirupa or Jocelyn, can you put your email in the chat, please? Everybody, remember, you can download the chat at the end of this, so which we will be closing now. Dr. Goldman, we can't thank you enough. As you know, there's so much misinformation out there. So you're suggesting that we keep our masks on even if we're vaccinated.
Yes.
I know when this
I'm in a closed office right now, which is why I don't have mine, but I always have mine at the ready. I wear it in the hallways. I wear it when I'm walking to the bathroom. I can't emphasize that enough. If you're traveling, and we're all kind of getting back to traveling, we need to go places, we need to visit family members. We need to do that, but you need to be careful. You need to wear a mask. And I think that's what makes this a more dangerous time, frankly, this year than last year, because there's a false sense of security that COVID really isn't a thing anymore. And that just could not be further from the truth. Again, our hospitals are filling up. People are continuing to die from this or have chronic debilitating effects from this. Wear your masks and wash your hands at all times.
And what about eating in restaurants?
I
know it's hard.
Eat outside, please. If you're going to eat at a restaurant, I strongly recommend eating outside. I nearly had a heart attack when I walked in to get takeout the other day from a place and saw the place fully packed with no masks. but I'm careful because I know that you all are business owners. And I also know that one of my favorite restaurants closed during the pandemic because of no customers. And so I'm really sensitive to that issue. Small businesses are the fabric of everything that we do. And I really don't want more chains coming in because they can wither this. And so I understand. But if you are going to go into a restaurant and make that choice, then go in wearing your mask and take off your mask to eat your food and then put it back on. Do that at least for yourself and for your community. And if you are going to go into a restaurant, be fully vaccinated. That's really the time that again, you're protected from severe illness or death from this. So if you are going to make that choice, at least make an informed choice. Do everything you can to protect yourself. Be fully vaccinated and wear your mask at all times. Wear your mask walking into the restaurant. Wear your mask even in between bites if you can, and definitely wear your mask when walking to the restroom. That's what I would suggest.
Well, thank you again for your time. I don't see any more raised hands and we're a little bit over. So everybody, thank you for attending. This is recorded. Download the chat before we disconnect. And Memorial is a great community partner and sponsor of all our local chambers. So thank you so very much. Norma, any closing words?
If you want to share our upcoming multi-chamber mixer,
Okay, go ahead.
let me just pull the flyer
We
up.
have two of them actually.
We'll share August for the sake of time, guys. We've been partnering virtually, so we're excited to actually reunite in person. And we're going to be meeting outdoors at Tiki Tiki on, what's the date? Randy, help me. I'm looking for the date.
It's the 31st of August.
The 31st of August, and I'm sure you guys will be getting some information from your respective chambers. Again, thank you so much to Memorial. Thank you, Dr. Goldman, for informative presentation. Have a great afternoon. Take care, be safe, wear your mask.
Yep.
Thank
And
you.
get
everyone.
vaccinated and encourage others to. Thank you, everybody.
Thank you, thank you, thank you. Goodbye.
Have a great afternoon and the rest of your week. Bye,
You
everybody.
as well. Thank you. Thank you, Randy. You too.
Thank you so much. Bye.
Please download the chat. I'm just holding on so everyone has an opportunity to download the chat.
If you need the chat and you can't get to download it or don't know how to, email me. I'll send it to you.
Thank you, Jesus. Your
My pleasure.
contact information is in our chat, correct?
Yes, Jesus@freedomtaxresolution.com.
If anyone else is waiting to download the chat, let me know. If not, I'll end the meeting.
You can end, I got it.
You got it? Thank you so much.
I got it.
That's a good one, doctor.
Thank you, Cherie, for joining.
It was a great meeting. Sorry I don't have a visual today, but thank you.
No
everyone.
worries. I'm sure a lot of our members I've been referring to you. I know people having
know.
a hard time to find employment, so I appreciate you.
Yeah, we're trying our best, so keep it coming.
Yes.
Thank you. All right, take care.
As soon as unemployment ends at the end of September, we have a lot of people knocking on our doors too, looking for jobs.
Hopefully.
Yeah.
Hopefully.